Professor Weber, why do we need interoperability for eHealth?
Well, for two main reasons. One at the side of caring for patients, the different points of services are connecting and exchanging information, because the healthcare system ultimately has a lot of points of service, and a patient who approaches these points of services needs something like a continuity of care, and information is very important for that continuity of care. And if electronic information systems can exchange that information, then it gives better treatment outcomes. There's more information available for the caregiver to make the right decisions, and it's safer for the patient as well. And then the other dimension of interoperability is about research and practice improvement. We need to understand better how treatments work, what is effective, what isn't effective, how we spend our money wisely. Some drugs, for example, may not be effective at all, but they have been prescribed in this way because we don't have the right information to really understand the evidence to make the right decisions. So we need to do what's called translational medicine, learning from actual outcomes. And for that purpose, we need to consolidate all the various data in these information systems to do research.
Would you please name a few examples with regard to the points of information in eHealth regarding actual care?
Well, the eHealth system is, you could say, stratified in multiple levels. There's primary care, so the first line of defense in healthcare is the family doctors, where patients who don't have the very urgent conditions approach the healthcare system. And then there are hospitals, obviously. Those are more for emergency care or surgeries. And then there's a tertiary care, specialist care, such as oncology, palliative care, and so on. All these various points of service, points of care, need to interoperate to provide this continuum of care that we really need.
So we are talking like hospitals, pharmacies, but also like wearable health devices and things like that.
Oh yeah, that's a very important newer development, the wearable, the consumer health space. I mean, there's wearable devices that are prescribed as interventions by the formal healthcare system. Those are medical devices that are usually licensed, but there are also a lot of wearable devices in the consumer health space where it's expected that they help patients, or I should say citizens, even if they're still healthy, with staying healthy and managing their conditions, and ultimately reduce costs in the healthcare system. So interoperating with these apps and devices is an important challenge and an important goal as well. Yeah.
And with regard to research, we would be talking about data sources such as from biobanking.
Yeah, biobanking for sure. There are there's a lot of interest as well in mental health research on how cognitive decline works. For example, as you know, Alzheimer's, dementia, huge challenges associated with those. There's an important research objective to find effective treatments, and I'm, for example, involved in one of the projects in Canada and British Columbia that attempts to interoperate with consumer devices on assessing cognitive functions and detection of change points early on when there are changes in the cognitive capabilities to mitigate these effects as early as possible, because some of the treatments, some of the new drugs that come on the market are only effective if you detect the change points early.
So please describe a few more of those sample projects which are happening in British Columbia with regard to interoperability.
Well, British Columbia is part of a federated country. Canada has a electronic eHealth interoperability blueprint, but ultimately in Canada, healthcare is under the jurisdiction of the provinces. So there is an overall interoperability architecture blueprint, but each province is implementing its own version of it, which creates some challenges, so to say. It sometimes I would prefer if healthcare was a national jurisdiction, such as in Germany. It would make it easier from a politics perspective to decide on a single system or a single standard and so on. So in Canada, it needs to be negotiated between the different provinces, which creates some issues. But there is a Canadian health information interoperability architecture blueprint that is cloud-based, so to say. It's based on the health information being in a shared record in the trusted internet, which is different, for example, for some of the solutions that we have in Europe, in Germany, with Gesundheitskarte, where the information is on, or some of the information is supposed to be stored on the chip card. That was considered in Canada for a while as well, but then decided not to do this for one reason or another. The information of the health records of all citizens are stored in a jurisdictional information system called the Shared Health Record System, and are downloaded then into the information systems at the various points of services, being the hospital or being the family practice, the family doctor or the pharmacist. There is a province-wide drug information system in British Columbia that connects all the different pharmacies. And we also have now started a project of connecting these EMR systems used in the different primary care practices to a research network, so that we can really do this evidence-based research, looking at the actual impact of different treatment guidelines on the effectiveness of the patient process.
So what would be required to really make a big step forward now?
So there are some technical problems to be sorted out, in particular on how to interface the data formats that a computer can understand to a human person who authors this information and reads this information. Many of the interfaces that we're creating in software nowadays are not very usable, which creates a lot of frustration and brings the user of these information systems to actually circumvent the data entry that is desired, so to say, which decreases interoperability. But there are also a lot of challenges that are of non-technical nature in interoperability. There are questions about, for example, the liability, the safety of information being exchanged. How reliable is a piece of information that you as a provider receive from another person's healthcare organization? Can you rely on it? Do you have to validate it? Who's responsible for any inaccuracy? There are also questions as to incentives. Are the software companies, are the users of these healthcare systems actually interested in interoperable? Do they have a win-win situation where its interoperability is also a value proposition for them? There's a lot of cultural and political hurdles for systems to really be interoperable, and these need to be addressed as well. So it's not all a technical challenge, it's actually a socio-technical challenge.